Mental health is about how we think, feel, and behave. It affects how we handle stress, relate to others, and make choices. Just like our physical health, our mental health is important at every stage of life, from childhood and adolescence through adulthood. Good mental health means being able to cope with life's ups and downs. It means feeling good about ourselves and having positive relationships. Unfortunately, many people experience mental health disturbances. These are conditions that affect our thinking, feeling, and behaving in the ways that cause distress and difficulty in functioning. Mental health disturbances can range from mild to severe, and they can affect anyone, regardless of age, background, or lifestyle. It's important to remember that mental health disturbances are not a sign of weakness. They are real health conditions that require understanding, support, and treatment. By learning more about mental health, we can break down stigma and create a more supportive and compassionate society. Mental health disturbances are complex and can be caused by a combination of factors. Understanding these causes is crucial for prevention, early intervention, and effective treatment. Let's explore some of the key contributors to mental health challenges. Biological factors play a role in mental health. Genes we inherit from our parents can influence our risk for certain conditions. Brain chemistry, including imbalances in neurotransmitters like serotonin and dopamine, can also contribute to mental health disturbances. Hormonal changes, particularly during puberty, pregnancy, and menopause, can impact mood and emotional well-being. Chronic illnesses, such as heart disease, diabetes, and cancer, can also increase the risk of developing mental health problems. Substance use, including alcohol and drug abuse, can have a significant impact on brain chemistry and mental health. Psychological factors also play a significant role. Past experiences, particularly traumatic events like abuse, neglect, or violence, can have a lasting impact on mental health. Unresolved emotions such as grief, anger, and guilt can also contribute to mental health disturbances. Personality traits such as low self-esteem, perfectionism, and pessimism can make individuals more vulnerable to mental health challenges. Cognitive distortions, which are negative thought patterns that distort reality, can also fuel anxiety and depression. Mental health disturbances can manifest in a variety of ways, affecting our thoughts, emotions, behaviors, and physical well-being. Recognizing the signs and symptoms is essential for seeking timely help and support. Emotional symptoms are often the most noticeable. These can include persistent sadness, hopelessness, or emptiness, feelings of anxiety, worry, or fear, extreme mood swings, including periods of euphoria and irritability, loss of interest or pleasure in activities once enjoyed, and thoughts of death or suicide. Cognitive symptoms involve changes in thinking patterns and mental processes. These can include difficulty concentrating, remembering things, or making decisions, negative or intrusive thoughts, feeling disconnected from reality or having delusions, and experiencing hallucinations such as hearing voices or seeing things that aren't there. Behavioral symptoms are changes in the way a person acts or behaves. These can include withdrawing from social activities or relationships, changes in sleep patterns such as insomnia or oversleeping, changes in appetite or eating habits, engaging in risky or self-destructive behaviors such as substance abuse or self-harm, and difficulty controlling emotions leading to outbursts of anger or frustration. Mental health disturbances can have a profound impact on various aspects of daily life, affecting our relationships, work, and overall well-being. It's important to understand these impacts to provide appropriate support and reduce the stigma surrounding mental health. Relationships with family and friends can be strained when someone is struggling with a mental health disturbance. Communication may become difficult, and loved ones may feel confused, frustrated, or helpless. Individuals experiencing mental health challenges may withdraw from social interactions or find it challenging to maintain healthy boundaries. Work and academic performance can also be significantly affected. Difficulty concentrating, fatigue, and lack of motivation can make it challenging to focus on tasks, meet deadlines, or perform at one's best. Absenteeism and reduced productivity can result from mental health challenges, leading to job loss or academic difficulties. Physical health can also be impacted. Mental health disturbances are often linked to physical symptoms such as headaches, stomach aches, muscle tension, and fatigue. Chronic stress and anxiety can weaken the immune system, making individuals more susceptible to illnesses. Seeking support and knowing when to reach out is, well, a crucial step in addressing mental health disturbances. Recognizing the need for help and seeking professional support are vital actions. It's important to remember that you don't have to go through this alone. There are resources available to help you on your journey to recovery. If you've been experiencing symptoms of a mental health disturbance for an extended period, it's essential to reach out to a healthcare professional. Don't ignore persistent feelings of sadness, anxiety, or hopelessness. Early intervention is crucial for effective treatment and can significantly improve long-term outcomes. Trust your instincts. If you feel like something isn't right or your mental health is impacting your daily life, don't hesitate to seek help. Your concerns are valid, and seeking professional guidance is a sign of strength, not weakness. Remember that you're not alone. Mental health disturbances are common, and many people have walked a similar path. Reaching out for help is a courageous step towards recovery and a brighter future. Addressing mental health disturbances often involves a multifaceted approach that combines various treatment modalities tailored to the individual's specific needs and preferences. Let's explore some of the most common and effective treatment options available. Psychotherapy, also known as talk therapy, is a cornerstone of mental health treatment. It involves working with a trained mental health professional to explore thoughts, feelings, and behaviors contributing to the disturbance. Various types of psychotherapy are available, such as cognitive behavioral therapy, which helps identify and change negative thought patterns, and dialectical behavior therapy, which focuses on emotional regulation and coping mechanisms. Medication can be an essential part of treatment for certain mental health disturbances. Antidepressants, anti-anxiety medications, and mood stabilizers can help alleviate symptoms and improve overall well-being. Medication management should always be supervised by a qualified healthcare professional, and it's crucial to follow the prescribed dosage and schedule. Lifestyle changes play a significant role in supporting mental health recovery. Regular exercise has been shown to have mood-boosting effects, while a balanced diet can provide essential nutrients for brain health. Prioritizing sleep is crucial for emotional regulation and overall well-being. While addressing existing mental health disturbances is essential, promoting positive mental health and well-being is equally important. By adopting proactive strategies, we can build resilience, enhance our coping mechanisms, and reduce the risk of developing mental health challenges. Nurturing strong social connections is crucial for maintaining positive mental health. Spending time with loved ones, engaging in meaningful conversations, and participating in social activities can provide a sense of belonging and support. Building a strong social network can act as a buffer against stress and provide a source of comfort during challenging times. Engaging in activities that bring joy and fulfillment is essential for overall well-being. Whether it's pursuing hobbies, spending time in nature, or listening to music, make time for activities that nourish your soul and bring you happiness. Practicing mindfulness and stress reduction techniques can significantly impact mental health. Mindfulness involves paying attention to the present moment without judgment, cultivating self-awareness and acceptance. Techniques like deep breathing exercises, meditation, and yoga can help reduce stress, promote relaxation, and enhance emotional regulation. Breaking down the stigma surrounding mental health is crucial for creating a more compassionate and supportive society. By fostering open conversations, challenging misconceptions, and promoting understanding, we can create an environment where individuals feel comfortable seeking help and sharing their experiences without fear of judgment. Educating ourselves and others about mental health is essential for dismantling stigma. By learning about different mental health conditions, their causes, symptoms, and treatments, we can challenge stereotypes and promote accurate information. Sharing personal stories and experiences can help humanize mental health challenges and foster empathy. Advocating for increased access to mental health services is crucial for ensuring that everyone who needs help can receive it. By supporting policies that promote mental health awareness, funding for research, and affordable treatment options, we can create a more equitable and just system for all. Remember that even small acts of kindness and understanding can make a significant difference in someone's life. By listening without judgment, offering support, and challenging discriminatory language, we can contribute to a more inclusive and supportive society for those experiencing mental health challenges.